My next guest is a medical doctor who says we should never make public policy out of fear. Welcome to another episode of Conversations. This is the show where I talk about anything and everything. My guest today is Dr. Joseph Lattipo. Dr. Ladapo is a researcher from UCLA. He's a physician, and he has been making the rounds talking about COVID, among other things. So, welcome to the show Conversations.
Hey, Carol, thank you. Thank you very much for having me. I'm happy to be chatting with you this morning.
And so, first off, we are going to do Carol and Joe, or Joseph, or what do you go by, Joe or
Yeah,
Joseph?
most people call me Joe, so that sounds great. Yeah, it sounds
Okay.
great.
Okay, Joe. I mean, all of us have had our lives upended by COVID, and you're based in California, right?
That's right.
And so
Yeah.
you've had some of the most restrictive um, laws, I guess, in the nation when it comes to mask and shutdowns. And I think that you're the right person to talk about this issue. So, what have we done right, and what have we done wrong when it comes to COVID?
That's yeah, sure. So I think the things that we've done, I think I'll start with what we've done wrong. Um, Actually, I take that back. I'll start with what we've done right.
Okay.
I think that the things that we've done right, probably maybe the thing that we've done most right has been to just put together an all-out scientific effort to try and understand the pathophysiology of the disease and its epidemiology. And that it's really been remarkable. I mean, basically, you have researchers across the country and across the world, and whose specialty might be, you know, cancer or heart disease or strokes or some other condition. And so many of these researchers and scientists have basically dropped what they've been doing, and engineers, they've dropped what they've been
Of
doing.
course they have. They're following the money.
Yeah. Yeah, as a scientist, I want to believe that they're many researchers go to enter research because they are really curious and they're
I know how they
excited.
enter because I was a professor for 28 years, so I understand research, but also understand research dollars, how
Mhm.
that can influence an agenda. And today, and I don't want to get you in trouble with the scientific community, and so you promote your community, and I'm the skeptic, I'm the cynic, and so I'll
Yeah.
say that they're following the dollars in a lot of cases. And but one of the things that attracted me to your research, you believe that we use the fear factor in a way that was not in the interest of the American public.
Yeah, absolutely. I very strongly believe that, and I believe that since the beginning. That there's been the fear-fueled decision making and fear-fueled informing of the communication with the public. It's just been a it's a it's been a terrible thing over this year, and it's just allowed for just a number of really atrocious decisions. And it's true. That's really, I think that's been there have been several things that have not gone so well, and of all of them, that probably is the worst.
Well, we talk about fear, there's the fear of the public because there's so many people that that lived in fear. They were afraid to go out of their homes, and when Dr. Fauci said put on 3 masks, they put on
Mhm.
6,
Yeah.
and so that is the public. But then there are the media forces, that kept putting up the statistics. And then you had, the interests of the pharmaceutical community and just various other people that may have fed the fear of the public. So the people who may have been most fearful would be the public. They're relying on all these other people to get them good information.
Yeah, yeah, I think that's a really accurate assessment. The communication from people like Dr. Fauci, from other public health officials, has been, it's really been atrocious. And I'm only grateful that I think every day more Americans wake up to that fact, when now they're seeing sort of these same forces try to ramp up fear again with the Delta
Yes.
variant. So I'm grateful more Americans are seeing that and appreciating that. But it's just been terrible. I mean, it's been completely terrible. Carol, the other thing I'll say about it is that the reason it's a problem having fear be the basis of a campaign of information, of communication, is that it just leads to terrible decisions. Two big mistakes that we made. The first was not doing a better job of protecting the vulnerable. I want
Yes.
to tell you, Carol, I was working in the hospital at UCLA in March, during the week that Governor Newsom shut down the state. And I was working with a team of residents and medical students, and they were terrified. And I was a little afraid too. And so what I did with my team is that we had data already from Wuhan at that time. So we looked at the data together, and the data very early on showed that this was a disease that primarily affected older people. And that was the population that was most vulnerable, not children, not young people. It very clearly concentrated its harm in older people. So we knew that early on. And with that knowledge, what we should have been doing, what it should have been focusing on protecting older people. But we did, but instead it was, lockdowns, putting healthy people, in their homes, terrifying healthy people, keeping people from working, destroying businesses, destroying the sort of social structure of children with their education, having this pull out of school. So it was we were making the wrong decisions early on, even though we had information.
Well, Joe, what is rational about that? I mean, these decision makers, from the highest echelons of government and these scientific agencies, why would they all sign on to a process that's irrational? And I know you can't read their minds, but what do you think may have happened to cause people to behave in such a irrational manner?
That's just another great question. It's really interesting. So I'll tell you what I think. And obviously, as you
And I,
said,
and I'll tell you what I think too.
yeah, yeah, I want to hear. I I actually think that 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 the emotion behind it, is was kind of this combination of uh, political hatred. I mean, the media hate Donald Trump, so his position on it has, just really put them. They reacted wanting to be on the very opposite end of it. So
Right.
Donald Trump was being reasonable. He said that don't let the cure be worse than the disease. Don't live in fear. He said these things. That's really good advice.
Well, let me stop you. So you diagnosed it was Trump derangement syndrome.
Yeah, right. Yeah, absolutely. It was a terminal case of that, and to the detriment of everyone in the country. Um, I think, you mentioned something about money earlier, and I think actually that was a component too. I would say greed would be the term I
That's
would use
right.
to describe it.
Much stronger.
And actually, it's interesting. My feeling from watching some of my colleagues was that there was there was a a feeling that came along with being needed and feeling important, in terms of like issuing these like public health orders, and commanding people into their homes.
Or that would be the God syndrome.
Yeah, Yes, that's exactly right. And many of my colleagues completely got drunk on it. I mean, it just that's why they made sometimes just the silliest statements. I'll just to give you one example. You remember the
And Joe,
yeah,
we're going to a break in a few seconds. So I
okay,
think I want to hold that example until
sure,
we
sure, sure,
return. But
yeah.
I mean, this is fascinating stuff. We'll be back in a moment.
Conversations with Dr. Carol Swain is made possible by Cooper Steel, a family-owned business that provides the steel fabrications for some of the greatest buildings across the United States. 60 years ago, Kenneth and Faye Cooper founded their company in Shelbyville, Tennessee.
Cooper Steel believes in sponsoring Carol Swain because we believe as she does, you build strong, you stand strong.
What started as a vision and now a nationally recognized and operated company that remains true to its founders' Judeo-Christian values and principles. Cooper Steel is committed to excellence, responsibility, and community. Cooper Steel's motto is, build strong, stand strong. They treat their employees and customers like family. Thank you to Cooper Steel for standing strong with Conversations with Dr. Carol Swain. Learn more about our generous sponsor at coopersteel.com.
I'm back with my guest, Dr. Joseph Lattipo, and we're talking about COVID and how it has been mishandled by many of our decision makers nationally, locally. It's been a disaster in many ways. And so, Joe, you were about to give us an example before we went to break. So, could you pick up there?
You betcha, you betcha. And so the example, more examples are coming into my mind, but I'll start with one. Okay, I'm a doctor. My my colleagues are doctors. Doctors treat patients. We want to treat patients. It's what we do. It's how we think about disease, and that's that's what doctors do when there's a disease. That's not what happened. So instead, what happened was that doctors were telling people who had COVID and had risk factors like obesity or older age or diabetes. They were telling them with the diagnosis to go home and wait. So that's basically all we heard about for a year. And what the reality is that this whole time there has been evidence, clinical evidence for medications like ivermectin, medications like hydroxychloroquine,
Right.
medications like vitamin D. And in the early on, now it's very clear that ivermectin is effective. I mean, it's only a matter of time before NIH acknowledges it, but that's very clear. Other medications, fluvoxamine, it's likely to be effective. Um, so what doctors normally do is we try and treat patients even when there's uncertainty about therapies. That's the right thing to do. When the benefit outweighs
Right.
the risk and you're talking about a safe medication, that's what we do as doctors. We try and save lives. But my colleagues, many of them were more sort of interested, and frankly, it's this sort of greed piece with sort of being in the spotlight and being able to order people around. We're more interested in telling people who are high risk to go home. It is crazy. Those people should have been treated early, and almost certainly it would have saved thousands of lives.
Joe, I'm very cynical. And when COVID first broke, I was very suspicious because there seemed to have been an incentive to get the death numbers up. And I think that the failure to treat high risk people was because they wanted those statistics to keep going up for the fear factor. There were when you go to CNN or various news places where they had the death numbers, we know from reports that they were classifying deaths from almost any kind of condition, including in some cases they said suicide and car accidents as COVID, anything to get those COVID numbers up. And I believe that it created a perverse set of incentives that affected people that had a particular political agenda. And so I don't think you can divorce what happened from politics. But I also have to say, Joe, that you're mighty brave to, be talking about your colleagues. And I know exactly what you're talking about. And so you're a brave man. We're going to be praying for you after this show airs.
Yeah, I will take the prayers. It's true. Unfortunately, I mean, I work with some other doctors, and it's really been a grassroots organization with, and I was brought into it. So doctors like Dr. Peter McCullough, Dr. Harvey Reich, Dr. George Fareed, Dr. Brian Tyson. You may know some of those names, but these are some doctors who have been from the beginning trying to persuade other doctors to look at the evidence, to
Right.
see that there were signals of benefit in studies of these medications, and to use them to treat patients and save lives. This is what doctors do. But
Right.
just this whole, the euphoria, this just what you're describing about kind of this reaction to Trump and this feeling of power and telling people to do this and do that and don't do this and don't do that.
But Joe,
Common sense just out the window.
I interviewed some doctors, and not the ones that you named, but there's been doctors all across the country that have been sounding the alarm and they've been treating COVID patients. But I believe California was one of those states where, for the first time, there was a state directive that you could not prescribe some of those medicines that you listed that were affected. And I was told that that was the first time that for a physician, you had an outside agency telling you what you could prescribe for your own patient.
Yeah, yes, Carol. There were many states and many pharmacies that took a position like that, and it's just crazy. Pharmacists are wonderful, and for example, they're wonderful. They care about patients, but they're not doctors. So if someone's board certified, licensed doctor prescribes a medication, that the pharmacist should, should give the patient that medication.
But again,
And
it's the
it's
money.
really just
Follow
been
the dollars. Follow
terrible.
the dollars.
Yeah, there's, whether it's greed for power or greed for money or both. It absolutely has been a big component of this pandemic.
What I have been told is that thousands of people died because they were not allowed to get the information that would have saved their lives. And then when big tech got involved, the social media, and they would not allow you to post information about alternative treatments. I mean, that's pretty serious when big tech is so controlled by a government that has an agenda that they are able to withhold life saving information from people who need it.
It's just it's so unbelievable. It's hard to wrap your mind around. And I'm just hoping that Americans don't forget, because the time is coming when some of these medications that Facebook and Twitter and YouTube were rushing to crack down on, in videos. I'm just hoping Americans don't forget, because they do need to be held accountable for those decisions. They absolutely cost many lives, and it not in a these decisions that relate to health policy. There's always risk, right? There are benefits and there are costs, but this was an example where we're talking about safe medications that
Right.
that were information about which was withheld from the public. And it's just, I just really hope Americans do not forget, and I certainly will be helping them to not forget, because the
And
time is coming.
we need to go to another break, but it is true that the high risk populations, they were most adversely impacted. And doctors, like you and some of the others who spoke up about it, some of them were severely penalized. I know some lost their jobs because of it, but I applaud you all. And we're going to have more with you after this break.
Dr. Carol Swain's Be the People, a call to reclaim America's faith and promise, newly released in paperback and audio with a new introduction, is a challenge to all Americans. If you are serious about being the best citizen you can be, this is the book for you. From addressing moral relativism to reclaiming the future, you'll understand why Dr. Swain is one of the most relevant voices in today's culture war. Are you ready to reclaim America's faith and promise? Purchase at bethepeoplenews.com/books or wherever books are sold.
The Biden administration's executive order on immigration brings to the forefront one of the most volatile issues of our time. In this timely second edition of Debating Immigration, I join my voice to that of other experts to provide you with facts and information that will help you understand what is at stake for our nation. This edition offers 21 original essays that cover race, religion, economics, human smuggling, and civil rights.
Purchase at bethepeoplenews.com/books or wherever books are sold.
I'm back with my guest, Joe Ladapo. He's a doctor at UCLA, and we've been talking about COVID and how it was mishandled. And Joe, I see here from your bio that you've been funded by NIH and you've led numerous clinical trials and you've been very successful as a physician. And so my question to you is, given the cancel culture, the politics that we have surrounding us, do you fear any retaliation for giving these interviews? I know you had an article in the Wall Street Journal recently, and you've been quite outspoken. So why would a young man like you have a family, right?
I do.
Children?
I do.
How many?
3.
Okay. A young man like you, 3 children, why would you risk everything to go out and make the statements that you're making to the world about the mishandling of COVID? Why would you do that?
I know I know sometimes I think about that myself. You know what? I think it is faith or belief. I know God exists, and
are you a
and
Christian and you feel that you're called to speak truth? Or I mean, how did this come about that you are speaking these things?
well, I think that because God exists,
Uh-huh.
there's more than just what there's much more than
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 this
just
life,
what is
right?
here, right?
Yeah.
And it's and it what we are all called to be the best of whatever we can be, and to aspire to become the best of what we can be. And and i i think that when you are a lot of you may not be aware, but if you are aware and you choose not to do the right thing, like that's not good, whether it's karma, however you want to think about it. Like, God is there.
You don't
The
sleep
universe
so
is
well at night.
watching.
In
you
other
know
words, you don't sleep so well at night.
yeah, the universe is watching, and if and you don't do or don't speak, it's very understandable. I mean, it's easy, hey, I don't want to be a part of this, too hot. And sometimes that is the right decision, because maybe the things that are at stake are too important, or it's not the right time, or something like that. But for us, we do have a young family. Everyone's healthy. God forbid, whatever happens, we'll roll with the punches. And that's why.
Well, I mean, I really admire you because I agree 100% with the information you presented here. I've heard a lot of it from other people, but hearing it from you, someone that's at UCLA, and I have to tell you, back in the 90s, I had a job offer from UCLA. I chose Princeton. But so you're in a state, that is as progressive as you can get, and you're displaying all this courage. And so I hope other young people are watching your example, and you will be able to impact them, because we are here for a purpose, and what we do matter. We're all going to die at some point, and so we need to make sure that what we do with the time we have on earth, that it makes a difference in other people's lives.
Yeah, I agree with you. I agree with you.
So tell us about other things that you're working on, because this is the last segment, and I want you to be able to say what you want to say about the things that you see are important that we all need to be concerned with. And so we've done that with COVID, but there may be other things that we need to know.
Sure, sure. Um, I'll stick with COVID for a moment. So I'm doing some research that is looking at whether people who are more fearful of COVID were more likely to have to overestimate the risk of being sick. So we're
Yes.
looking at that. We're looking and examining whether people who overestimate the risk are more likely to favor lockdowns and keeping kids out of school, closing schools down. We're also doing some work on the mental health and the kind of emotional and spiritual health burden. So we're looking at how that and other researchers have looked at this too, but looking at what that mental health cost has been. It's mostly been in the background in terms of the news. We're hearing a little bit more about it, but it's actually been a devastating year for the mental health of young people. It's been a devastating year for substance abuse. We don't hear much about it, but it's we've had record numbers of opioid overdoses. We've had record numbers of cases of hospitalizations and emergency department visits for alcohol abuse and other substances. So there's really been just an enormous kind of mental health, emotional health, spiritual health burden associated with the lockdowns and how we approached COVID over this past year and a half or so. So
But
that's some of the work I'm doing.
but Joe, it sounds like you have many teams operating at this time on these various studies.
That's right. That's right. So before COVID, this was kind of work I do, and I've continued to do it through COVID, and now doing some other stuff. But yeah, I'm really interested in cardiovascular health. I just really love it. I want people to be heart healthy, brain healthy, avoiding heart attacks, avoiding strokes, avoiding kidney disease, and cardiovascular disease is a really central to that. So my clinical trial work has been focused on weight loss and smoking cessation, and we also actually have a study of cardiovascular disease prevention in people with HIV. So yeah,
And you graduated from Wake Forest. Are you from North Carolina? And
I
they
went
got
to
you.
high. I went to. Oh, I'm sorry. I think there's a. I'm sorry. There's my motorcycle. I went to high school and college in North Carolina. That's right. Before that, I lived in Georgia. Before that, I lived in Louisiana, and before that, I lived in Nigeria. So my folks came to Louisiana when I was about 5 years old.
So you are a descendant of immigrants.
I am.
Well, that is very interesting in and of itself. Your rich background and what you're trying to give back to our country, and so I applaud you for that too. And can you tell our viewers how they can get in contact with you? You can give your social media handles or whatever information you'd like for them to have.
Sure. Well, I'm under Joseph Lattipo on both Facebook and LinkedIn, and it's easy to Google me, and you can see my UCLA webpage. And feel free to, people reach out to me all the time, send me emails, questions, comments, feedback. So people can reach me that way also.
Well, it's been a pleasure and a delight having you on Conversations today. And we wish you well with your research. And I would encourage my viewers to pray for you, because I think you've taken a bold step, and there are probably some arrows that will be aimed at you. But, again, you're a courageous young man. I wish you the best. We need more people like you. Thank you.
Thanks, Carol. Thank you.
And we'll be back after this break.
For those of you who would like to know what exactly our children are facing in their education system, this is a must-read book. It will equip you and prepare you to make decisions about your child's health, about your child's education. So I want to encourage every one of you to grab a copy of Dr. Swain's book and join with me and Carol on the front lines in this critical time to eradicate the liberal abduction of our children.
Thank you so much for tuning in to this episode of Conversations. We've learned a lot from Dr. Joseph Lattipo, and he's doing work that is courageous. And we should all be willing to engage in courageous works. I hope you will share this show with people who need to see it. And there are a lot of people that we know who are still living in fear. They need good information about COVID. And I think that we can help with regard to treatments. And we don't have to succumb to the fear factor that's gripped our nation. So tune in again next week. Looking forward to seeing you.